All right, let's do an article on cryotherapy and its effects on like neural inhibition, the arthrogenic neural inhibition after surgery. So the author started off talking about neural inhibition and what it is, and really that it can happen after injuries and surgeries and how bad it can be because it delays the rehabilitation process that we have. It is super, super common in the quadriceps, and that's why they chose to use this area. The techniques that are used to try to limit or prevent neural inhibition stuff that happens, definitely the normal exercise that we try, but there are some modalities like electric stim that can create muscle contractions and biofeedback. When it came to cryotherapy, there was a couple decent articles and results with combination ice and e-stim and some other things, but not very much, varying results with just cryotherapy alone. So there wasn't really a good evidence on that, and so nothing in the quads after surgery. So that's why the authors tried to do this. So their purpose was to determine the effects of cryotherapy on quadriceps EMG activity, isometric strength, following, right after in the early stages of knee surgery. Their hypothesis was that, this was going to help. Cryotherapy was going to help increase both of these. So method-wise, they took 22 healthy folks, or not healthy folks, but young folks that had knee surgery, and they were mostly ACL and meniscus surgeries. This was a 2x2 repeated measure, so that means each patient got each treatment, and they had a pre and post test for each one, and so they basically were measured against each other. So there are their own results or their own effects. The EMGs this is where they put the EMG to actually detect muscle activity. They did this handheld dynamometer where they tried to do isometric knee extension, and then of course they did the 10-point VAS to measure pain and see what they did. So whatever treatment they were doing, and they randomized which treatment that each person did first, but whatever treatment, for each treatment they had pre-treatment measurement, they had either the ice or the sham treatment, which was kitty litter, and then they did a post-treatment. And then the cool thing was that the tester who was taking these numbers and results didn't know if it was kitty litter or ice at any given time. For the results, on the EMG and muscle activity, this is the table from the actual article, but the big takeaway is right here. The vastus medialis was the only one that really showed a significant increase in muscle activity after the cryotherapy treatment. The rectus femoris and vastus lateralis really didn't, and we can talk about that, why I think that later. But yeah, if you're interested, isometrically, or the actual strength ability was a lot better, or a lot more significant. When you see this number right here, there's a lot more strength after the cryotherapy than the sham treatment. The pain, I didn't keep the pain or put the pain one up here because there was just no significant differences between the kitty litter and the crushed ice. So the authors did conclude that cryotherapy does lead to an increase in EMG activity and isometric strength. So clinically, the way we use this is athletic trainers, we can consider using cryotherapy in our rehabilitation, like before exercises, to generate more strength and more muscle activity to get through some of the early exercises and hopefully progress our patients a little bit quicker. Critique-wise, there's a number of them, and you can see what I have listed on the screen here. But there's the ones I didn't like. This is only post-surgical, so there's that, and that's an obviously easy fix. But here's this last one is really one I wanted to focus on. This is only one treatment, one point in time. So I would be interested in the future looking at a longer, applying this like we would in a normal rehabilitation setting, and be like, all right, let's do a bunch of these treatments over, say, a couple weeks, and then measure that, that kind of, results of EMG and strength. And then does it actually lead to longer term outcomes? Do they actually progress through their rehab quicker? So that would be my takeaways, my future studies where I'd like to go.